Hello, lovely people. Welcome back to my channel. My name is Abdul Malik. You can call me Experience One. Today we are going to look at ectopic pregnancy. This particular topic mostly affects a lot of women. So we are going to talk about it and then its relationship when it comes to the NCLEX exams. Ectopic pregnancy is the implantation of the fertilized ovum outside the uterine cavity. You know, when you look at the structure of the uterus, we have the fallopian tube, we have the fimbriae, and then we also have the cervix and the body itself, talking about the endometrium where embedment mostly occurs, or implantation mostly occurs within the uterus. So after the fertilized ovum, after the egg is released into the fimbriates, is also transmitted or transported through the fallopian tube into the endometrium, for which is what is implanted within this particular the fundus of the endometrium. So what mostly happens is that the fertilized ovum, after it's fertilized within the fallopian tube, what happens is that it does not reach to the endometrium or the fundus where it will be embedded. So what happens is that it's embedded or implanted outside the uterus. So that is why we say that in this case ectopic pregnancy has occurred. So the uterus will grow, and then what happens is that it grew, and due to the fact that the space within the fallopian tube is very limited, what happens is that the enlargement of it can cause it to rupture, which is very dangerous. So when ectopic pregnancy occurs, we need to hurry up so that we can be able to either terminate it or we can manage it before it gets out of hand. So it's very, very dangerous. And then we know that when it comes to the ectopic pregnancy, we say the most common location is the ampulla of the fallopian tube. The ampulla of the fallopian tube is where the ectopic mostly occur, the implantation mostly occur. Now let's look at some of the causes, some of the things that can lead to ectopic pregnancy. You know, if you have ever had ectopic pregnancy before, okay, you are likely to have it in your subsequent pregnancy. And then also inflammation or infection. Whenever you have UTIs and you are not treating it well, you are likely to have this particular ectopic pregnancy. And then also fertility treatment. Some people are infertile, so they go for fertility treatment, and then when this thing happens, the chemicals used to wash, and then also washing of the uterus in order to help you get pregnant. Okay, all these procedures can lead to ectopic pregnancy, and then especially when you get pregnant. And then tubal surgery. If you have ever had fallopian tube surgery before, okay, or tubal surgery before, because of the scar, okay, what happens is that it delays the transport of this particular fertilized egg, okay, into the uterus. So because of this, it delays, and then what happens is that it sticks to the fallopian tube, especially the ampulla, and then what happens is that there's going to be ectopic pregnancy. That's one form of it. And then also birth control. This area is very important because we know that in recent times, most of the women take birth control, contraceptives. Okay, all these things can lead to ectopic pregnancy. So it's one thing that we should be careful about. So a lot of ectopic pregnancy, okay, that is occurring recently might be attributed to this particular birth control pills and birth control medication that we vaccines and all kind of things that we mostly take. It is very dangerous, so we have to look at it. And then also smoking also lead to ectopic pregnancy. How do we manage it? How do we manage ectopic pregnancy? And then let's see how the assessment of this particular condition occurs. Of this particular condition, especially the signs and symptoms. You know, you are going to miss your period, so it's very important. Okay, you will miss your menstrual period, and then abdominal pain is going to occur due to what? Due to the enlargement or the growing of the fetus. Okay, it's also one of the things that you can see. Abdominal pain is going to occur, and then vaginal spotting to bleeding. Okay, you see that there will be some small tiny bleeding, okay, that will come, especially sometimes it look bright red, and sometimes it looks what? Dark. Okay, it's also one of the things that you can see when you have ectopic pregnancy. And then when it ruptures, what are those things that you will see? Now take note of this, because NCLEX mostly when it comes to prioritization questions, they use this particular area a lot. The rupture of the fallopian tube, especially with regards to ectopic pregnancy. Okay, now when it ruptures, there's going to be an increased pain, and then shoulder pain. When you see all these things, especially in the NCLEX exams, you see that the question will be like a person with ectopic pregnancy, okay, complains of severe abdominal pain that radiates to the what, to the shoulder. When you see all these things, it indicates to you that the ectopic pregnancy or the pregnancy has, or the tube has ruptured. Okay, so it is a surgical emergency. We need to do something about it immediately. Okay, so take note of this in the NCLEX exams, especially when it comes to prioritization questions. Okay, don't underestimate it. But then signs of shock can also occur. Signs of shock can also occur. How do we manage it? Talking about intervention. Vital signs is very important, and then we need to monitor bleeding and initiate measures to prevent rupture. Okay, so we need to manage for the bleeding, and then we need to also try to prevent the rupture of this particular one. So there is a particular medication that we mostly give, methotrexate. Okay, methotrexate or folic acid antagonist. Please take notice of this in the solving your NCLEX exams, or if you have this medication can be given. Okay, if we want to prevent surgery, when it's given early, it can what? It can help treat this particular problem. So take note of that. Methotrexate or folic acid antagonist. These medications can be used to treat the ectopic pregnancy. And then also, we need to also try, and then we need to also prepare the client for surgery. You know, we have to repair, especially when we know that there's nothing that can be done. We need to treat it, so we can do a surgery or a repair of what, of the condition. And we can also administer antibiotics because of infection. Now, there's something about NCLEX exam that we have to be careful. You know, in recent time during our private discussion, we made mention about this particular one, and I said that, look, when the mother is RH negative, it doesn't matter what time the pregnancy occur, whether below 20 weeks of gestation, whether above 20 weeks of gestation. Take note of this, okay? When the mother is RH negative, because we don't know the status or the group of the fetus. The fetus can be RH positive due to the fact that there can be complications in the upcoming pregnancies. We need to give something that we call RHD immunoglobulin or ROGAM, okay, or ROGAM. We give it so that in the subsequent pregnancy, the mother will not be able to get complications like the subsequent abortion. So take note of that. ROGAM is very important, especially when you are solving the NCLEX exams. Okay, it's very, very important. So this one is prescribed when the mother is RH negative. So this comes to the end of this particular class. But let me tell you something. You have to be careful because there are a lot of things that are happening, especially with regards to the contraceptives that we mostly take them. Okay, we need to be careful taking them. Okay, so we have to educate all women about this particular condition so that they can avoid all certain chemicals, and before they can be able to take in any medication, they should consult their healthcare provider or the doctor before taking them. Thank you once again. This particular program is sponsored by American Dream NCLEX Prep. So please contact us for all your NCLEX needs. Have a nice day. Bye-bye.